Okay.
All right.
Anyhow, just climbed up on Jules. Takes all I can do to chase her around my arena here a little bit, trying to warm her up. I've got pounding pain. My shin is just like on fire. I've been up all night practically with muscle spasms. Well, it was muscle spasms. I had to take a Valium at midnight just to even get any sleep. It's so numb and contracted and so pulling in my leg. It's just unbelievable. And you might say, well, geez, why am I on a horse? Well, I worked so hard to recover from the SI surgery that I just want to enjoy a moment or two with my horse, because come surgery for this joint, I'll be laid up again. And we, of course, got a beautiful spring summer day here on about May, whatever day we're on, May 5th. And I just want to enjoy my beautiful animal here. I mean, people that don't ride horses wouldn't understand that when you're on a horse, they give energy back to you. It's great for your endorphins. I mean, they give to you compared to maybe a static exercise, laying on the ground doing exercises. You get energy back from the horse. It's a circle of energy, and they give to you, and you feel that. And that's why for a horseback rider, it's, you know, to get your little hiney back in the saddle is such a blessing. And you know, I'm doing well in this area. A few ligaments underneath are a little bit, you know, a little tight, but then some of it is this back of this leg here is coming up and pulling on me, because that major posterior subluxation of that proximal Tib-fib is just poking in the back of my knee here, and I'm spasmed, and my whole shin is numb, and the bending of the dorsiflexion of my ankle just drives the pain right up through the Tib-fib joint. I mean, really, it'd be better if I could just hang my leg like that. It would be easier. And I do that, but when I first get her going, I like a little safety. I like to have my stirrups. But as far as the SI in here, sitting in here feels really good. My seat bones, the ischiums under my seat bones here feel even. They're not feeling off or anything. The ligaments connected to them need a little bit of work. Some are a little looser, some are a little tighter. But that's to be expected in reconditioning this malalignment syndrome I've had, Lord knows how many years, 10 plus years. But in the saddle, at least, you get movement. And that actually loosens you up. I mean, I felt really good after our ride yesterday, and then I had to do a lot of infrared. I did infrared heat therapy devices on my gluteus last night to calm down the tightening of spasm, because these muscles are getting worked in a way that they hadn't been worked for the prior 10 years, because it's all changed. My hips now work as hips. My SI joint is not being my left hip. Okay? In other words, it's neutral and secure, so the hip joints are actually being hips without moving that SI that was always chronically stuck in the wrong position. I mean, it really has been a blessing. I mean, it's only been since January 17th, and we're coming up on February, March, April, May, 4 months here at the middle of this month, and it really is a miracle. My lumbar back is not being poked. I feel like I can sit up straighter. I don't have pokiness going in the back, in my back here. What can I say? I'm just thankful to God that I was able to have the surgery and it all worked out, and I'm here to tell about it. So I am looking forward to the next surgery in about a week for this stabilization procedure for my proximal Tib-fib joint, and hopes that that joint will be stabilized in its neutral position so it can't go posterior and get stuck, and then all the spasms and the guarding of the pulling of the muscles in the lower leg will be able to calm down. And I know this because we've already experimented for the last 6 weeks doing bracing, you know, chiropractic adjustments, put the joint in neutral, braced it. I walked on crutches, and all the pain has gone away 100%. So I know that if that joint were stable, the pain is going to go away. I believe in myself. I believe in God that shows me these things in my heart. I've lived with this condition, and I've ruled out everything else. That proximal Tib-fib joint is causing transient nerve symptoms right now, even though I've had the nerve decompressions. So the nerve decompressions were absolutely successful because I've experienced it again with the joint in neutral and it not being irritated by walking on. All my nerve symptoms are gone all the way down my leg. But with the joint posteriorly subluxed, it's not neutral, it's pulling on the tissue is pulling over the nerve routes, and I've got this nerve pain going down my leg just like I had even before the nerve surgeries. So, what can I say? I'm just happy that a good doctor named Dr. Mann in Missouri, who wrote a case study about a lady similar to me back in 2009 about the proximal Tib-fib instability and posterior dislocations, he's going to do surgery on me, and I'm forever grateful, and I'm looking forward to that. It will not come without some hardship. It'll be the most challenging post-operative surgery I've ever had as far as not being mobile, because I won't be able to walk on my leg. All my other surgeries I've had thus far, I could always walk. So there will be a hardship, but it'll be for the greater good. And to that extent, I'm looking forward to getting back in my saddle in July or August, or whenever the doctor releases me to do so, and be able to sit here with my leg down and feel like my leg on the other side without pain shooting up from my ankle to my Tib-fib. Thank you.